Understanding basic lab principles is very important. It is the foundation of good science. Medical labs play a huge role in healthcare. They provide crucial information to doctors. This information helps in diagnosing illnesses. It also helps in treating patients effectively. Without labs, medicine would be guesswork. Many lives depend on accurate lab results. This makes lab work incredibly serious. Labs are not just rooms with equipment. They are centers of vital analysis. Samples like blood and tissue are examined here. Scientists look for signs of disease. They use complex machines and methods. Every test must be done carefully. A small mistake can have big results. Patient health is always the main concern. This demands high standards from everyone involved. The importance of the lab extends beyond individual patients. Lab data helps track public health trends. It can identify outbreaks of disease. This allows for quick public health responses. Research labs also develop new tests. They find new ways to fight illnesses. So the lab is key for today's health. It is also key for tomorrow's medical advances. Therefore, everyone new to a lab must learn well. They must understand every basic step. This includes safety rules and procedures. It means knowing how to handle samples. It also means keeping accurate records. Good training prevents errors and harm. It ensures the lab can do its vital work. This is the first step to mastering lab basics. Medical laboratory personnel have many roles. They are the skilled hands in the lab. Their responsibilities are wide and varied. They receive and process patient samples. They perform complex tests on these samples. They must ensure accuracy at every stage. This is a very serious duty. Doctors rely on their findings for patient care. Their work directly impacts health outcomes. Each person in the lab team has a specific job. Lab technicians often perform routine tests. They operate and maintain lab equipment. Medical technologists may do more complex analyses. They might also troubleshoot problems with tests. Pathologists, who are doctors, interpret results. They provide diagnoses based on lab findings. All these roles must work together seamlessly. The main responsibility is ensuring test accuracy. This means following procedures exactly. It means calibrating machines regularly. It also means running quality control checks. Any error could lead to a wrong diagnosis. A wrong diagnosis can lead to wrong treatment. This could harm the patient significantly. Thus, attention to detail is absolutely critical for all personnel. Beyond testing, lab staff manage information. They record results carefully and clearly. They ensure patient data is kept confidential. They communicate findings to doctors promptly. They might also help in training new staff. They contribute to a safe lab environment. Their professionalism upholds the lab's integrity. They are truly guardians of diagnostic truth. A strict code of conduct governs laboratory work. This code ensures professionalism and safety. It is not just about technical skills, it is also about attitude and behavior. Every person in the lab must follow it. This code helps maintain high standards. It protects both patients and staff. It is vital for a well-functioning lab. Honesty and integrity are core principles. Lab results must always be reported truthfully. There is no room for falsifying data. Mistakes should be reported, not hidden. This allows for correction and learning. Patient confidentiality is also paramount. Personal health information is private. It must be protected at all costs. Gossiping about patient cases is forbidden. Professionalism extends to appearance and demeanor. Lab coats should be worn and kept clean. Personal protective equipment must be used correctly. Maintaining a focused and serious attitude is key. The lab is not a place for casual behavior. Distractions can lead to dangerous errors. Respect for colleagues is also essential. Teamwork relies on mutual respect. Adherence to all protocols is mandatory. This includes safety rules and testing procedures. Shortcuts are never acceptable in a lab. Questionable practices must be challenged. Continuous learning is part of the code. Science and technology are always changing. Lab personnel must keep their knowledge updated. This commitment ensures the best possible service. This unseen code protects the lab's vital mission. Safety regulations are not suggestions, they are commands. In a lab, these rules protect everyone. They prevent accidents and injuries. They also protect the wider environment. Ignoring safety can have terrible results. It can lead to harm or even death. Therefore, knowing and following all safety rules is essential. Every lab has specific safety manuals. These must be read and understood by all staff. Common lab accidents include chemical spills. Cuts from broken glassware are also frequent. Burns from hot equipment can occur. Accidental needle sticks are a serious risk. These can transmit infectious diseases. Slips, trips, and falls also happen. These might seem minor but can cause injury. Understanding these risks is the first step. It helps in preventing them from happening. Prevention measures are varied and crucial. Always wear appropriate personal protective equipment. This includes gloves, lab coats, and eye protection. Know the location of safety equipment. This means fire extinguishers and eye wash stations. Handle chemicals with extreme care. Always label containers clearly and correctly. Dispose of sharp objects in designated containers. Never eat, drink, or smoke in the lab. Good housekeeping is also vital for safety. Keep work areas clean and uncluttered. Clean up spills immediately and correctly. Report any unsafe conditions to a supervisor. Regular safety training is also important. This keeps knowledge fresh and up to date. A culture of safety is everyone's responsibility. It requires constant vigilance from all personnel. This proactive approach minimizes dangers effectively. Section 5. Urgent Care. First aid essentials in the laboratory. Accidents can happen even with strict safety rules. Knowing basic first aid is very important. A quick and correct response can reduce harm. It can sometimes save a life. Every lab member should know first aid. They should know what to do in an emergency. This knowledge empowers individuals to help. It makes the lab a safer place for all. For chemical spills on skin, immediate action is needed. Rinse the affected area with plenty of water. Do this for at least 15 minutes. Remove any contaminated clothing carefully. For chemicals in the eyes, use an eye wash station. Flush the eyes continuously for 15 minutes. Seek medical attention for all chemical exposures. Report the incident to your supervisor right away. Cuts from glassware need careful handling. Do not pick up broken glass with bare hands. Use a brush and dustpan instead. If cut, apply direct pressure to the wound. This helps to stop the bleeding. Clean the wound if it is minor. Use antiseptic and a sterile dressing. For deep cuts, seek medical help immediately. Report all injuries, no matter how small they seem. In case of a fire, remember RACE. Rescue anyone in immediate danger if safe. Alarm by activating the fire alarm system. Contain the fire by closing doors. Extinguish if the fire is small and you are trained. Otherwise, evacuate the area calmly. Knowing these basic steps is critical. Regular drills help reinforce these procedures. They prepare staff to act decisively in a crisis. Section 6. Handling the invisible threat, safe management of infectious materials. Infectious materials pose a serious risk in labs. These include blood, body fluids, and cultures. They can contain harmful bacteria or viruses. Handling them safely is absolutely essential. This protects lab workers from getting sick. It also prevents the spread of disease. Special procedures must be followed diligently. There is no room for carelessness here. Always treat all biological specimens as potentially infectious. This is known as universal precautions. Wear appropriate personal protective equipment, or PPE. This includes gloves, gowns, and face shields. Work in designated biological safety cabinets when needed. These cabinets protect both the worker and the sample. Avoid any actions that create aerosols. Splashes and sprays can spread germs. Decontamination is a critical step. All surfaces and equipment must be disinfected. Use approved disinfectants regularly. This kills any potential pathogens present. Spills of infectious material need immediate attention. They must be cleaned and disinfected carefully. Follow specific spill protocols for biohazards. This prevents contamination from spreading further. Proper disposal of infectious waste is vital. Use clearly marked biohazard bags or containers. Sharps, like needles, go into puncture-proof containers. Waste must be treated before final disposal. This is often done by autoclaving. Autoclaving uses steam under pressure to sterilize. Following these rules protects public health. It prevents lab waste from harming others. This careful handling is a core lab responsibility. Section 7. The paper trail. Why clinical lab reports and records matter. Clinical laboratory reports are not just pieces of paper. They are vital medical documents. They contain crucial information about a patient's health. Doctors use these reports to make diagnoses. They also use them to plan treatments. An accurate report is essential for good care. A mistake on a report can have serious consequences. It could lead to the wrong medical decisions. Proper record keeping is equally important. Every step in the lab process must be documented. This includes when samples arrive. It includes who performed the tests. It includes the results and any issues. These records create a traceable history. This history is important for quality control. It helps if a result needs to be checked later. Good records show the lab works correctly. Lab reports must be clear and easy to understand. They should include patient identification details. They must list the tests performed. The results should be shown with reference ranges. Reference ranges show what is normal. This helps doctors interpret the results. Any critical or unusual results must be highlighted. They should be communicated to the doctor quickly. Maintaining these records has legal aspects too. Lab records can be part of a patient's legal medical file. They must be stored securely to protect privacy. They also need to be kept for a specific time. This time period is often set by law. Accurate and complete records are a sign of a professional lab. They support good patient care. They also protect the lab itself. Section 8. Stocking for science-effective management of lab stores and supplies. Managing lab stores and supplies is a key task. It ensures the lab can function smoothly. Without the right materials, tests cannot be done. This can delay patient results. It can disrupt important research work. Good inventory management is therefore essential. It means having what you need when you need it. It also means not wasting resources. A well-organized storeroom is the first step. Supplies should be stored in a logical way. Similar items should be kept together. Everything needs to be clearly labeled. This makes it easy to find things quickly. It also helps in tracking stock levels. A clean and tidy store prevents damage to supplies. It also makes stock taking much easier. Regular checks of expiry dates are crucial. Keeping track of inventory is very important. Many labs use a system for this. It could be a simple logbook, or it could be a computerized system. This system records what comes in and what goes out. It helps to know when to reorder supplies. The first in, first out FIFO principle is often used. This means older stock is used before newer stock. This helps prevent items from expiring on the shelf. Efficient management saves money and time. It prevents running out of critical items. It also avoids overstocking, which ties up funds. Overstocking can also lead to waste from expired items. Regular audits of supplies are necessary. This confirms that records match actual stock. Good supply management supports the lab's daily work. It is an often unseen but vital function. Section 9. Essential orders, reagent indenting, storage, and a commitment to excellence. Indenting reagents is the process of ordering them. This must be done carefully and on time. Running out of a key reagent stops testing. This can cause serious delays in patient care. The indenting process usually involves filling a request form. This form specifies the reagent needed. It includes the quantity and any special requirements. Approval from a supervisor is often needed. Proper storage of reagents is extremely important. Many reagents are sensitive to light or temperature. Some must be refrigerated or frozen. Others must be kept away from moisture. Incorrect storage can ruin a reagent. A ruined reagent will give wrong test results. This can lead to misdiagnosis and harm. Always check the manufacturer's storage instructions. Follow these instructions exactly. When new reagents arrive, they must be checked. Ensure the correct item was delivered. Check for any damage during shipping. Record the date received and the expiry date. Store them immediately under the correct conditions. Sensitive reagents may need special handling. Some chemicals are hazardous and require secure storage. This prevents accidents and maintains their quality. In conclusion, every aspect of lab work matters, from basic principles to managing supplies. Safety, conduct, and accurate record-keeping are vital. Careful handling of samples and reagents is key. Each step contributes to reliable results. These results directly impact patient health. A commitment to excellence in all these areas is not optional. It is the core of responsible laboratory practice. This dedication ensures the lab serves its critical role in medicine.